distinguished participants, colleagues, ladies and gentlemen, Assalamu alaikum and good morning. I am pleased to be here with you today to make a few remarks on behalf of WHO at this important global forum as we work together to enhance global food safety systems. As you've heard, Uzbekistan has initiated the process for access to the World Trade Organization and has participated in several technical sessions with WTO members and the Secretariat. A significant measure in this regard has been the draft law of the Republic of Uzbekistan on food safety, which you have also heard about this morning, that was prepared in 2023 and includes a separate chapter on the development and implementation of sanitary measures following the requirements of the WTO. Becoming a member of WTO will provide an opportunity for Uzbekistan to not only increase economic growth, but also to shape its trade policies to better impact public health and strengthen the national food control system. This is essential to keep a balance between trade interests and health priorities that will ensure the well-being of people and prioritize resource allocation for the areas that require additional reinforcement. WHO is increasingly concerned about what are known as the commercial determinants of health, along the lines of the social determinants of health. WHO proudly works closely with Uzbekistan to support the country in the strengthening of National Codex Alimentaris, InfoSan, and enhances multi-sectoral collaboration for One Health, which includes food safety, AMR, and zoonotic diseases. And this is done through the Codex Trust Fund and Pandemic Fund projects that we hold. WHO's Global Strategy for Food Safety 2022-2030 aims to guide and support member states in their efforts to prioritize, plan, implement, monitor, and regularly evaluate actions towards a reduction of the burden of foodborne diseases by continuously strengthening food safety systems and promoting global cooperation. However, the successful implementation of the strategy requires understanding of the status of the national food safety system in a country. IFC and WHO have been working together to develop a simple and easy-to-use tool to assess the country progress on country-level implementation of the WHO Global Strategy for food safety. The strategy proposes for the first time indicators for member states to measure progress in strengthening their national food safety systems. These indicators are based on the International Health Regulation systematic assessments, the joint external evaluation, and the state parties' annual self-reporting tool. Using this new tool will allow Uzbekistan's competent authorities to discuss aspects of the national food safety system and to identify strengths and areas for further improvement. And the workshop will begin tomorrow for this. Implementation of this tool will support the development of a national roadmap until 2030 that will allow competent authorities to plan and prioritize resource allocation for the areas that require additional strengthening. This roadmap will align with or be integrated into the National Action Plan for Health Security, which is currently in the final stages of development in Uzbekistan, following the IHR Joint External Evaluation in 2022. The new WHO IFC assessment tool takes a comprehensive approach and fills the gaps between the IHR-JEE and the state parties' annual assessment report, and the broad capacity of national food systems. Additionally, the tool also assesses the adoption of the One Health approach in the national food control system and the capacity of the system to prepare and respond to climate change and food systems transformation issues. You will hear much more about this tool from my colleague Simone Moraes Razbou, who is sitting here with me and will speak after me. This work will eventually serve as the basis for a larger full-scale FAO assessment. Uzbekistan will be the first country to use this tool, and I take this opportunity to congratulate the government of Uzbekistan, namely Uzbekistan San Ethics Committee, for their continued commitment and contribution to taking this important global work forward that will allow us to validate the tool. WHO stands with them in this endeavor to support and guide the process. I look forward to hearing about this week's outcomes and wish everyone a productive and fruitful forum and workshop and an enjoyable stay in the lovely city of Tashkent. Dr. Rahmat, and thank you.
Good morning, everyone. I would like to first thank IFC for inviting WHO again. It's the second time that we participate in the IFC Food Safety Forum, and it's a big pleasure to be with you and to share our work. That is also, we have been talking this morning about partnership and working together. And the way we are working with IFC, I think it's a nice example how we can partner and how we can engage different stakeholders with the same objective, to improve food safety and taking a global perspective. So I will explain a little bit how we are doing that and what are the plans, how we are working together with IFC in the implementation, to support the implementation of the Global Strategy for Food Safety. In 2022, WHO adopted by member states the new Global Strategy for Food Safety. This strategy has a timeline for implementation from 2022 until 2030, so we are already in progress. This strategy has the vision to ensure that all people everywhere consume safe and healthy food. So it's not, we're also talking about nutrition and food fortification. It's not about only be nutritious or only be safe, we have to have both together. So we are working, I will give you an overview of the strategy. We have a full version available online in English, and the executive summary is available in the other UN languages, including Russian. And the full version of the Russian version will be available soon. I know that's also a language that you can manage. So that will be soon be published, the full version in Russian with the support of our regional office in Europe with our colleague Peter. So the strategy, I wanted to give you an overview. The strategy has 5 strategic priorities, and they're based on components of the food control system. I'm not going into details, but just to give you an overview and how that impacts the priorities in Uzbekistan. So the first strategic priority is related to national regulations and having a regulatory framework to food control system. So it's the foundation, it's the basis of a food control system. All the activities that will be implemented in the following strategic priorities, need to be a base on the regulatory system. The second strategic priority is related to respond to food safety challenges resulting from food systems transformation, from climate change, to, in some places we are seeing countries are adopting resilient systems for climate change, but forgetting about include food safety perspective in that. So how the resilience approach can impact food safety in a negative way. So we need also to take that into consideration. Pillars, it's evidence-driven, people-centered, has a forward-looking approach, and is cost-effective. And we implemented that through international cooperation. So, as Sheena also mentioned, this is the first time the One Global Strategy for Food Safety proposed indicators for member states. In the previous food safety strategy in WHO, we had indicators for us, for our work, how many countries we are supporting.